Hello, thinking of having a baby before you stop your birth control, or you're not on a birth control but you're thinking of having a baby, because we know all what leads to having a baby. But before you have that baby, we have a checklist for you. That is your preconception care, okay? And that's what I'm presenting to you today. So many of you out there, you'll be wondering, who is this, who is that? Yeah, I'm Josephine, a clinician, a doula, both birth and postpartum, and I do care for mothers before pregnancy, during pregnancy, and after pregnancy. So part of it is the preconception care, and this is the ultimate guide to have a checklist, the things you have to do before you have that baby. So keep it here. So you could be wondering, what's preconception care? What is it all about? So preconception, as you hear it, preconception, this is the care, or this are the things you have to look out for before you have that baby. And these are the things that determine the success of you, the mother, and the baby after all this is done. So let's have it here. So according to UNFPA, the United Nations for Population, they say, actually I think the article 2022, it says most of the pregnancies are unplanned, or almost 60% of the pregnancies are unplanned, and 45% they end in abortion, and 25 they end up to birth. And a few things happen there. Maybe some people get miscarriages, some may be having risk pregnancies and they can't carry them to term. But those ones who are really can't, like those who can't carry it on, some end up in abortions. Yeah. So now here is the ultimate guide to help you know what are the things you need to check out before. Okay, let's go into it. So number one is the medical and family history. Yeah, here is like, in your family or in your lineage, do you have people suffering from chronic illnesses? Could be diabetes, could be especially your mom's side, because we have it like 80% of the genes are from the mother. So the mom, what happened during her pregnancies? Did she face any problems? Some of them actually might have faced problems, but then things work out good for you because of the good care you take of yourself, or even, but your genes sometimes cannot be cheated. So we have family history and medical history. Do you have any chronic illnesses? Are you suffering from diabetes? Are you suffering from maybe hypertension, sickle cell, a lot? Maybe in your family, maybe if someone is pregnant, some of them, they develop diabetes, have gestation diabetes, or they face a lot of challenges. So we have to look into that. But mainly the medical history, we are going to look at the body, the person, and even the partner. Your partner, are they facing, do they have medical chronic illnesses? Actually, to the man's side, also diabetes affects them, hypertension affects them. We also have to check out the sperm count. We have to check up the health of the sperms, or the quality of the sperms. Yeah, so that is checklist number one, tick. So we go to number two, screening. Many of you out there, you just go Actually, that's why we call it unplanned. But if you're planning it, the ultimate planned kid, you have to do certain tests and screen out your baby. We are going to screen out for sickle cells. Actually, this you should do it. It is for the baby mostly, and for you, the mom or the parents. So it's really a sad life. It's really sad. I've seen sickle cell patients at the hospital. Someone comes in with excruciating pain. They're in pain because the parents, maybe the father was a carrier and the mom was a carrier, so they end up having a positive baby for sickle cells. So I encourage couples to screen out for sickle cells. Screen out for STIs. Yeah. Those are the sexually transmitted infections. Screen out, because actually these affect you. Some people end up having miscarriages because of STIs. They end up having, especially to the woman you may find like your uterus is affected due to the continuous infections you're getting. PID, that is the pelvic inflammatory disease. You find that your uterus has been affected, like continuous infections. So we have scarring due to the untreated infections. We have like, actually those infections sometimes they cause inflammation and it causes unnecessary heat inside there, and it cannot contain a pregnancy. That's why you see some of them are just miscarried, and it's really sad in case you were planning or like you're excited about it. But since we are planning, so we get to screen out that. What else? We have to screen. We have genetic counseling. You have to screen out for genetic counseling as a couple. Some diseases, most of the diseases actually that affect the mother and the baby and the father, they end up are a danger to the baby. So for the health and for the good of the baby, you get to screen. Okay? Yeah. We need to screen for the rhesus factor. This is actually the number one. It's also among the causes of miscarriages. You find that the mom is rhesus positive and the mom and the baby is rhesus negative. Those two can't work. So the baby is out. We also need to check out for syphilis. We need to check out for HIV. We need to check out for gonorrhea. We need to check out for, I talked about the recurrent infections, especially in the women. In case you're planning, please visit the doctors. Some of you have a tendency of going to the pharmacy just because you know you have maybe a doctor or a family friend and they can get you the medicine you want. Some countries, it's good that you can't access antibiotics anytime, anywhere. They're not over the counter. But you find that in some of our countries, like back in Uganda, you can get any type of antibiotics you want from the counter, from the pharmacy. So you end up overdosing, or like polypharmacy, where you're taking too much medicine for even an unknown cause. So you have to get tested, see which kind of bacteria are you suffering from, which kind of bacteria are you trying to treat, so that you're treated for the right cause. Okay? So yeah, that's all. And there are other things you can screen for. Do scans. You find some people who don't have uteruses. Uteri. Okay. You find that maybe some are septed, in that like some is halfway, or some have malformations, some have scars inside, in that the baby cannot implant very well. So doing, especially the transvaginal scan, can help. Yeah. To the mothers hoping, please utilize those scans to help you know if everything, your reproductive organs, are they all doing well. Check out signs of there is this adenomyosis, endometriosis. So all those ones have to be checked out for. Thank you. We go to checklist number 3. Actually, I call this one the GOAT, the greatest of all time. So this is folic acid supplementation. The American Center for Obstetrics and Gynecology, they recommend every mom to start folic acid supplementation at least 3 months prior to conception. It may not be planned, but now we are talking about planning for the pregnancy. It might come unplanned, but okay, if it comes, you can start, no problem. But in case you're planning, 3 months prior to conception does well for your baby, because organogenesis, that's the first trimester, is so crucial, because that's when the organs for the baby start to form, and folic acid is that supplement the baby needs for all those organs to form. So I urge moms or mothers in the preparations of having a baby, it could be this year, it could be next year, 3 months prior, 1 month prior, but you start before, that's the best. But if you start after you confirm, because actually organogenesis starts before actually you test positive. You get, you can be like, oh, I missed my periods, let me go have a check. But if it comes out positive, meaning you have been pregnant before, so organogenesis has already started. So if you started your 3 months before, you're very good to go. And if you began later, it's also okay, but all good. So we recommend, the recommended dose is around 400 micrograms daily only. Actually, it's just 1 simple tablet, it's very small. It should be taken daily for the first trimester plus the, now we are talking about the start before 3 months to then. After the first trimester, you can live and try other medications. Checklist number 4. Number 4, we have fertility awareness. As a couple, are you aware of the fertility window of your wife as a man? And you as a woman, are you aware of your body? Do you understand your body? Do you know when you're in your ovulation days? Do you know when you're in your safe days, or unsafe days, I should say? So, the fertility window, this is the time, the actual time. Actually, it is recommended if you want to, if you're planning to have a baby, if you know, let me say now, like, we have your periods for 28 days. So your ovulation is on day 14. So you should have intercourse 5 days to the day, because the female egg only survives 24 hours. Once you miss that window, you try again the next month. Okay, so that's it. Also, if you're planning, what has been your family planning method before? Was it hormonal? Was it non-hormonal? So sometimes the hormones play with the body, and then the body needs some time, 2 to 3 months to reset. That's why 3 months is a good time. So your body needs time to reset, to have your hormones in check, so that you can conceive. If it's been non-hormonal, you're good to go. So also you need to know what are the physical changes that come new body. You have to know your body. Like if I'm towards my ovulation, there are some physical changes that occur. The cervical mucus, the color changes, the mood changes. Some of us have ovulation pains. You can really feel it on the side of the body, usually from the left. Yeah, mine is from the left. Oh, we have also breast soreness. Some people have their breasts are sore. You touch it, you feel some pain. Yeah, so you need to be aware of your fertility. Yeah. Number 5, lifestyle. Lifestyle changes. Actually, this is very crucial also. Lifestyle changes, what do I mean? Sedentary lifestyle. You need to be up and move. You need to be fit, physically fit. Smoking, alcohol, those things, avoid. Actually, you should avoid smoking in your preparation. If a man or woman, the couple, because the preparation is between two people, man or woman, you should quit smoking, you should quit alcohol. Yeah, you should actually, even the phone, it's like, it's recommended that use your phone when necessary. So do not overuse the phone. TikTok, regulate. Okay, so be faithful to one partner. That's also a very crucial lifestyle change. Be faithful to one partner. Why? Some of the causes of infections is having multiple partners. You're going to go from John maybe has gonorrhea, then you go to this one has malaria, you go to the other one has syphilis, so you end up piling up infections for yourself. So to the man and to the woman, if you're trying to conceive, because multiple sexual partners goes both ways, to the man and to the woman. So be faithful, at least for the time if you're preparing to have a baby. Be faithful to one another so that you can have the best outcome for the success of your baby. Yeah, nutrition. I think that's number 6. Yeah, nutrition. Nutrition is key to help one with the right nutrients for the baby, and maintaining a healthy weight. Or actually, some people fail to conceive because of their weight. Or actually, it is very risky. If I told you underweight, the risk can be to the baby because you end up having, you end up having a low weight for birth baby. So they recommended one should maintain a BMI. Actually, the BMI is the body mass index. Okay, it should be between 18.5 to 24.99. So if you want to calculate your BMI, it's simple. Just get your weight, current weight, and divide it by your height. But your height should be squared. Yeah. So if you have underweight BMI, which is now like below 18.5, you are likely to have preterm babies. You're just predisposed, so you are likely to have preterm babies or small for gestation age babies. Then those ones who are overweight, above 25, actually above 25, BMI 25, those ones face a lot. Actually, it's too risky. You can find that you have gestational obesity, like you become, if you've been overweight, you become obese because you're expected to gain around 12 kgs when you're pregnant. So if you've been overweight, so you add on those 12 kgs, and those extra coming. So you are likely to have stillbirths, you are likely to have congenital abnormalities, neurotube defects, preterm births, we have big baby actually. Those are complications. Why? Because this actually predisposes some mothers to have cesarean sections. It's not bad, but sometimes it's the only way to have the baby, because you as the mother, you'll be like, I want to push. Actually, this is also should be part of your birth plan in case what you want to push, but things can turn the other way around. But yeah, so you are likely to have PPH. So basically, we should work on our bodies to maintain the good. That BMI should be between 18.5 to 24.5. So medication. I talk about medication review. Actually, here you need to go to your doctor or your gynecologist. Tell them what medications are you using, and do these medications that you're using, do they have an effect, or like do they stop you, or like they stop you from conceiving? Do they have an effect on the baby? Is it okay to continue them throughout the pregnancy, or is it okay to stop? And okay, if you stop, is there any other alternative for it? So you should see your healthcare provider and have a talk between you and them. Vaccinations. There are a few vaccinations you should have, but I think there's some of them come in during pregnancy. But maybe you could take your flu vaccination, because some people are disturbed by flu. You could get your flu shot. You could get hepatitis B vaccination for the woman. And you should know, follow up your vaccinations. Actually, even after you conceive, you should follow up and know which one are you supposed to take in which month and at what time. Okay. And then we have social environment and mental health. Mental health actually is the most, actually, to some women it causes miscarriages. If your mental health is not in check, some people end up miscarrying their babies. They end up having actually they have it rough during their pregnancy. That's why you need to prepare. Most of the unplanned pregnancies, you'll be like, you're in regret. Why did I do this? Why did I do this? Can I do this? Can I do that? But if at all it comes in planned, you know, yeah, you wanted it and it came. So you're able to carry it on. And also having social support, like people around you, join the community, or like you have friends also who are on the same journey with you. Join community, like have people with you who are going to help you, to encourage you and to have your back. To the partners, to the men out there, support your women during pregnancy. This is a crucial time actually, because especially to the first time mothers, they don't know what happens. They have been told what happens, but they haven't felt it on their own. So please help them, guide them, and know and respond to their needs. Okay? Thank you. The last one, actually I think it should have come first, but okay. Finances, preconception care, we need finances, we need money. You need money to have those medical checkups. You need money to prepare for the baby. You need money. Actually, you need money to have everything concerning pregnancy. So, and if you have your financial goals and your financial situation is in check. You can't have it all, but you can be comfortable at the time, or you can even have it all. Yeah. So you can. Are you having enough to push you through this journey, or even after the journey? Are you able to pay for the services? Are you able to pay for your doula? Are you able to pay for your health checkups? Are you able to pay for the, maybe you want to go for a vacation, you want to go for relaxation therapy, you have to go to the gym to keep fit. You need money, so make sure your financial help, or financial, what should I call it, your finances are in check. Okay, yeah, so keep it here. This is my first video, and for more, keep it here. Subscribe to my channel for more pregnancy tips, wellness, maternal wellness, specifically newborn care, anything you need to know. Actually, let's meet in the comment section. Tell me what you think. Actually, you can even have an objective to what I've said in my video here. Please subscribe and follow my channel. Please like, comment, subscribe. Thank you. See you.